My name is Dr. Jessica Shepard, an OBGYN and women's health expert. I see women in the office every day, and many times their questions involve, how do I manage my leaks and why won't the tampon fit correctly? Now, if you prefer using tampons while on your period, it's very important that you find the right absorbency as well as know how to correctly insert a tampon to ensure that you're comfortable and making sure that you feel worry-free and leak-free. First of all, let's review some tampon basics and go through the actual anatomy of a tampon. Now, the tampon is comprised of an applicator, which is made up of the barrel, the plunger, the actual tampon, which you'll see here, and the string. Using U by Kotex Click Compact Tampon, we can see that it applies to all these terms. Now, when using this tampon, you want to pull the base of the applicator, listen for a snap, and when you hear that, you know that it's locked in place and able to be used. Click Compact Tampons capture and absorb the same fluid as a full-size tampon. Now, the difference between the two is that the Click Compact Tampon has a narrow applicator for comfort and also for convenience. It's so compact that it allows you to bring your tampon wherever you need to go. Also of note, you'll notice that both of these products have a string. Now, the string of a tampon is important because that's what should extend outside of the vagina for removal. Tampons come in a variety of different absorbencies, and that's for a reason. Women have different flows. When choosing the right absorbency for you, remember that absorbency is linked to the tampon itself, not the applicator. This means that absorbencies are consistent whether you decide to use a compact or a full-size applicator. Typically, your options for tampon absorbencies are going to be regular, super, and super plus. A regular tampon absorbs 6 to 9 grams of fluid, and then going to the super tampon, that's when you'll see the absorbency is going to range from 9 to 12 grams of fluid. And then going to super plus, the absorbency is going to be 12 to 15 grams of fluid. These absorbency ranges and their corresponding terms are required to be used by all tampon manufacturers, and the reason this is to actually indicate the amount of fluid that's being absorbed using a standard laboratory test. Once you've tested your flow on a regular tampon, typically what I tell patients is going for a lower absorbency if you find that even after removing a tampon between 4 to 8 hours, you still see a lot of white space on the tampon. Now, on the other end of the spectrum, if you are noticing overflow on a tampon string or your underwear, you might use that as an indicator to go to a tampon that has a heavier absorbency to decrease any leaks. In any case, always remember to change your tampon every 8 hours at most. Leaving a tampon in for more than 8 hours might actually increase your risk for an infection and irritation. In general, I recommend choosing the minimum absorbency necessary to control your actual menstrual flow and to ensure a comfortable fit and reduce any risk of infection. It is also recommended not to use any tampons to help manage vaginal discharge when you're not on your period or after giving birth. For more information or instructions on how to use tampons, please check out ubykotex.com.